Shut the privacy, wash my hands. Hi, I'm Dana. I'll be your student nurse today. Can I have your name and date of birth? Okay, good. I'm going to check your wristband. Alright, do you have any allergies, especially to betadine or latex? Okay, good. Today I'll just be inserting an IV into you. It shouldn't take too long and shouldn't be too bad, so we'll get you on the road. I'm just going to start by gathering my supplies. I have my blue pad that I've placed underneath you to make sure we don't mess up your bed. Okay, I'm going to start by getting my sodium chloride together with the tubing. Throw that away. I'm going to unwind my tubing. Okay, the cap is on it, so I don't have to worry about breaking sterility of either of the items. Okay. Make sure it is locked. Okay. I'm now going to remove the cap. Remove this cap, making sure not to touch it with anything else because it is sterile. So once the cap is removed, it cannot be, sterility cannot be broken. Okay. I'm going to place it inside of there. Okay. Okay, I have checked the medication of the patient, so I have the right medication, the right patient, the right dose, the right time, and the right route. So I'm going to start by priming this now, fill that up about halfway. I'm now going to lock this and make sure I run some of the fluid through to make sure that no air bubbles are in it. Okay, there are no bubbles in the tubing, so I'm going to now lock this back up and place this up here to get the rest of my supplies ready until we're ready. Okay, I'm now going to open up my IV kit, get out my tourniquet, my tape. Okay, I'm going to start by preparing my tape. Okay, now I have my tape ready. I'm going to get my alcohol swabs and prepare my needle. I'm now going to prime my other tubing. Okay. Make sure that I don't have any air bubbles in this one either. Okay, good. Now I'm just going to place this here for when I need it after I insert the IV. Okay, I'm now going to assess the patient's veins to make sure that there's a good one. Okay, I see one that will be good, so I'm going to start by ripping off my alcohol swab and cleaning off the area. This will also make the vein be more noticeable and prominent. So while that's drying, I'm going to apply the tourniquet about 6 inches above the IV site. Okay, and while that's on there, I'm going to apply my gloves. Okay, now that that has dried, I'm ready to insert the cannula. I'm using a 22 gauge cannula. Make sure that the bevel is up. I'm going to grasp the patient's hand. Okay, I'm going to insert it at about a 30 to 45 degree angle. Okay, and keep going until I see some backflash. Okay, I see some, so I'm going to go about another millimeter in. And as I'm removing the needle, I'm going to push the cannula in more so it can completely go in. Okay, so I'm now going to occlude the site as I throw that into the sharps container. While I'm occluding with one hand, I'm going to remove the cap and connect this, holding it with my 2 fingers. I'm going to connect those to make sure it doesn't move. Alright, and now that that's on there, I'm going to place a piece of tape to hold it down while we're checking this, to make sure it doesn't move. Okay. Okay, now I'm going to flush the line to make sure no bubbles form or irritation. Okay, I don't see any swelling or bubbles being formed, so it means that we are in the right vein. So I'm just going to place this here. And now I'm going to tape the rest in place. to make sure before we start the IV. Okay. Now I'm going to time and date the and tape this down with the tourniquet, and time, date, and put some gauze underneath. After I've timed and date that, gently I'm going to place some gauze underneath to make it a little bit higher up. Okay, now that that is there, and I've initialed and dated and wrote what gauge I used, I'm going to gently peel this back and remove the tourniquet before I do this, so the patient has some flow. Okay, I'm going to place this on here, getting it as close up as I can, but without blocking it so that it can be changed in and out. Okay, I'm now going to peel back I'm now going to remove my initials and date so that the next nurse knows what time this is all done. Okay, now that that's on there, I'm going to clamp this off and apply my alligator clamp. Okay, now that that is on there, I can apply it to the IV. I'm going to carefully remove the cap since it is sterile. Okay. Now I'm going to place this in here and turn it to secure it. Okay. Now that that is secure, I'm going to tape it to the patient's arm. And then I'm going to unclamp and let the medicine slowly begin to flow. Alright, so that is setting up the IV, and now I'm going to remove it. So I'm first going to clamp the IV to make sure that no medicine can get out. Okay, and after I do that, I'm going to take the alligator clamp off to take apart the IV from the actual patient's hand. We're done with that, so I'm going to place that up there. Now I'm just going to come back here, and I'm going to start by removing the tape. Gently removing the tape. I'm now going to use the last piece and take out the cannula. Okay, I'm going to have my gauze ready, so just in case there's any backflow or blood. Okay, move that out. Okay, I'm going to note that the cannula is intact, so there's nothing left in the patient. So I'm going to discard of that and tape down the gauze just in case the patient is bleeding. Alright, and I'm going to discard my gloves and clean up the area.